Hello everyone and welcome to the live session today. So I don't have any specific topic as such to discuss today, but it's been a long time we have done a live session. So and of course I wanted to let you know about our upcoming camps that we are planning to do. So hi everyone, thank you so much for joining in. And firstly I would like to thank you all for our camp in Surat. It was an amazing response. Thank you so much. It was a first camp in Surat, and I would like to thank you for that superb response that we got. This Sunday we are at Bandra Khar for our session for spinal manipulation. Normally we are on Saturdays, but this Sunday we are available at Khar, and next Sunday we will be at Lower Parel. So for all the people who are looking out for appointment in South Mumbai and Lower Parel, this will be a good option. So next Sunday we will be at Lower Parel also, and yes, we are our upcoming camp out of Mumbai is in Pune, which is from 29th 30th of May, 30th to 2nd of May, that is 30th, 30th, 31st, 1st and 2nd. 4 days we will be in Pune. So we've already started our appointments. They are filling fast. So in case you have not taken your appointment still, make sure you're doing that as soon as possible. And yes, I'm open for questions. In case you guys have any question, all the people who are looking out, official Sonika, Nirav, Devilal, Chotkool, Ravish, Malti Soham, Soring, Sadaf, Salor, Mohandas. If you have any questions, please shoot your questions and I'll be more than happy to answer your questions. Avina Chakravarti, Avishi, Krunal, Shah, Purushottam. Thank you everyone for joining in. Once again, I would like to inform you about our upcoming camps. We are in Bandra this Sunday instead of Saturday, and next Sunday we will be at Lower Parel. And yes, we have our upcoming camp in May, that is 31st May, 30th, 31st May, 1st and 2nd June. 4 days we'll be in Pune at Hotel Kapila Business. So make sure you are catching up. And Krunal Shah has a question. C4 C5 ka problem hai. Sure, problem, yes, it can be worked on. We can look into it and see how spinal manipulation therapy can work for neck pain. Basically, more than C4 C5 ka problem, it's it is important to understand what are your symptoms, आपके complaints क्या है, and based on that it is helpful to kind of treat you accordingly. ठीक है, काफ़ी टाइम ऐसा होता है कि हम एक MRI स्कैन ले लेते हैं 25 साल की उम्र में, 30 साल की उम्र में, 35 साल की उम्र में, और उसमें हल्का फुल्का डिजनरेशन डेफिनेटली रहता है, एंड दैट डिजनरेशन स्टेज इन योर माइंड एज अ डायग्नोसिस. आपको लगता है कि यही सबसे बड़ा डायग्नोसिस है. इट इज़ नॉट लाइक दैट. ये एक नॉर्मल डिजनरेटिव प्रोसेस है और हम उसको पूरी तरह डायग्नोसिस क्लेम नहीं कर सकते. हमें ये समझना है कि आपकी लाइफस्टाइल में, आपके ओवरऑल जो आपका काम होता है उसमें क्या चेंजेस हैं जिसके वजह से आपको ये पेन हो रहा है, और हमको वो चेंजेस करने हैं, या तो वो प्रॉब्लम्स दूर करनी है. अगर आप एक्सरसाइज नहीं करते हैं, अगर आपका पॉस्चर गलत है, तो आपको इन सब चीज़ों पे वी हैव टू फोकस एंड ट्राई टू सी कि हाउ वी कैन गेट रिड ऑफ दीज थिंग्स. Ravish Panikar has a question. Is it okay to get a massage if there is a lot of spasm on the back? Not all the time. It may not be advisable to take a massage if you have a spasm. A better way to clear off the spasm is firstly trying to apply some ice. अगर आपको spasm इसलिए हो रहा है क्योंकि it has happened because of sudden movement after which your back has got locked or समथिंग लाइक दैट. अगर ऐसा कुछ है तो उसमें स्पैज़म, उसमें मसाज करना इज़ नॉट अ गुड आइडिया. It is advisable to probably get into some icing, do some gentle stretches if possible, and once you are a little better, then only you should go for massage. Massage is not completely a therapeutic purpose. It is more of a relaxation purpose. थेरेपेटिक पर्पस भी उसका होता है जब हमें फेशियल रिलीज करना होता है, व्हेन वी हैव टू रिलीज द फेशिया एंड डू अ लॉट ऑफ अदर थिंग्स. सो इन स्पैज्म कंडीशंस डेफिनेटली मसाज इज नॉट एडवाइजेबल. Ankur has a question. Due to avian, I have only posture problem. limp हो रहा है. Well, Ankur, we need to understand what level of AVN you have, which is the avascular necrosis of the hip. So we will need to understand what is the level of AVN. There are different levels, level 1, 2, 3. In level 3, the avascular necrosis is really bad, and most importantly, total hip replacement is what is suggested. But in level 1 and 2, normally it starts with a little bit of hip pain, or probably in a limp when you are walking, or probably even pain on rest. So in all these conditions, doing a hip mobility or physiotherapy also helps. So definitely you can try for physiotherapy, or you can also try for manipulations, where we can see how we can try to release the hip area, and also see the tightness in the muscles, okay, and probably try to release that also, because hip, of course, AVN is the main important diagnosis, but the surrounding structures also get affected because of that, and it's important that the surrounding structures are also cleared off. Thank you. Good that there is no pain. So in that case, I think all you should look at is mobility. All you should look at is stretching, good amount of gentle stretching, so that your hip mobility is maintained, and understand the issues because of why the limp is occurring, okay, and we can definitely clear off. Yes, thank you. Mishraj Mishra Raj Vanshi. Okay, there are two names clubbed. Okay, what to do in case of tendinitis, arm and shoulder joint? Well, tendinitis is basically overuse of the tendon. Okay, or when there is an inflammation of the tendon, you need to see what exactly is causing this problem. It could be related to your occupation. It could be related to the work that you are doing on a daily basis. Even if you are a housewife, doesn't mean that you will not contract tendinitis. Or if you are into any activity, it could even be your regular workouts, jahan par probably there are some workouts which you are not doing right, which could lead to inflammation of the tendon. So you need to identify that. However, treating it, firstly, if there is pain, you can do some icing and some gentle stretches. If the pain is not relieved by that, maybe you should see a physiotherapist. If there is a restricted range of motion because of tendinitis, like you feel that the end range of shoulder is difficult to manage, raising your hand, it gives you pain, taking it outside gives you pain, then probably is a time where you can see me, and we can help to release the shoulder joint. We can also help on the scapulohumeral rhythm and try to improvise your scapulohumeral rhythm. So yeah, if all of this is done, Misha Rajvanshi. Okay, yes, so that's the inflammation, like I told you, so we can treat it that way. Pranab has a question, can forward neck be reduced with chiropractic session? Pranab, forward neck is not a permanent problem. Forward neck is a temporary problem. Forward neck happens because you choose to, or probably subconsciously your neck is way forward, okay, that's the reason forward neck happens. Yes, it can be treated. Chiropractic sessions will help you to reduce, but then it also has to be managed with exercise, as well as getting your posture in place. You have to be a little more conscious about your posture. You have to be a little more aware about your posture and try to correct it the moment you feel that it is wrong. Okay, so chiropractic mein aisa nahi hai ki you have a forward neck and we'll take it back. That's not going to happen. You understand that this is something which is coming after a long time. Your forward head is not coming yesterday and now it is today. It is not like that. It takes years for you to develop a forward head. Now when you have to treat it, you also have to give it a little bit of time, work on your posture, keep correcting your posture as and when you feel that it is going wrong. This typically happens when you are into a lot of mobile use, or probably when you are into a IT work where you have to sit and you have to kind of see the screen for a very long time, especially with a forward head and rounded shoulders. You need to see and understand your ergonomics. Where is your ergonomics going wrong? Probably your computer height may be too high, because of which you have to come forward, or probably it can be too far, because of which you have to come forward. So try to adjust the environment around you, which is your screen, your keyboard, the way you sit, all of this, and then see why you are getting into a forward head. Thank you. Manipal, I do jogging, sir. I'm 49, slow jog. Can I continue with it? I thought knee pains a bit. Jogging, if you're doing jogging 6 days a week, I suggest you can cut it down to 3 days and do a little knee strengthening exercise also. Okay, anything in excess doesn't work well for the body, and eventually your body will complain of pain. Okay, so we need to understand that when you are jogging on a daily basis, 6 days or 7 days a week, you're not giving rest to your knee joint. So obviously after a certain point of time your knee joint will complain. You have to give it back. You have to give it back in terms of knee strengthening. That's the reason 3 days of running and 3 days of jogging can help you and try to get you rid of this situation. If it is an initial knee pain, obviously this is the only thing that you need to do. Also check your supplements. If you're taking D3, if you're taking collagen, or if you're taking calcium on a regular basis. If not, you should go ahead and do that. So yes, thank you so much. I think we have hundreds of people who have joined in, and thank you everyone for joining in, and thank you for such a great response. Once again, I would like to remind you, this Sunday we are in Bandra for our spinal manipulation session. Wednesday and Friday I'm available in Thane, since we are based in Thane, and we are having an upcoming camp in Pune, which is from 30th, 31st, 1st and 2nd of June. 30th, 31st May, 1st and 2nd of June in Pune. This time we are in two different places in Pune, so check it out. The number for our appointments is 800-673-8000. I am putting up this number for appointment, and I will also pin this comment so that you can actually check it even after the session. 800-637-8000. That's the number for our appointment. Misha, I just said, when are we visiting Pune? All right, thank you so much for checking out the video. Goa, Fatima, I'll be coming in August. I'll be in Goa in August once again. Misha, visit in Pune. I'll be visiting on 30th, 31st May, 1st and 2nd June. All you can take appointments for any of our camp, or whether it is Mumbai, Thane, Pune, all these places, on the single number. So just call and confirm your appointment. Thank you so much for watching the video. I hope you enjoyed it, and if you have any questions for me, do put it in the comment section. We can always check and reply to your questions in the next upcoming live session. Thank you.